Welcome back to the Woven Well podcast. Today, we're going to talk about the impact of autoimmune issues on women's health. And honestly, I can't wait for it. I feel like in my work as a certified fertility care practitioner, autoimmune issues will come up more often than maybe you'd think. But these diagnoses usually happen during our exploration. Women have been living with symptoms for years without any knowledge that there is some sort of a diagnosis behind them. And so I really think that it's important for us to understand what it means to have an autoimmune issue, how they show up within women's health, and what our options are for treatment, maybe even before and beyond medication. So I've invited Dr. Mary Davis, an osteopathic physician and functional medicine practitioner, to join us. She's certified by the Institute for Functional Medicine, and her practice, Suma Medicine, focuses on working with patients who suffer from chronic, complex illness and those who want to optimize preconception health. Dr. Davis, welcome to the show.
Thank you so much, Caitlin. I'm really happy to be here.
I'm happy to have you too. And I'm so curious. You work with complex chronic illness, and especially when it comes to preconception health. Tell me a little bit about what that work is, or maybe how you got into it.
Well, it's interesting. I started out in emergency medicine, and I always felt as if I was never really getting to the root cause of disease. I mean, emergency medicine really exemplifies like acute problems, and it was rewarding in many ways, but I also felt this draw to like really help patients who are struggling with chronic complex illness and getting to root cause. And I also came across, my own challenges with fertility and health, and was able to meet those challenges and handle them with the help of actually naturopathic physicians and acupuncture, and sort of taking an integrative approach. And then it really inspired me to want to provide this for other people who had the same type of struggles and issues. And one of the other big draws for me is seeing the massive increase we're seeing in autoimmune conditions. It's just really kind of exploded. And also tying into that, the increase in childhood developmental disorders that we're seeing.
Mm.
So my draw and my passion is getting parents prior to conception so that we can optimize their health, and particularly mom's health, so that we can optimize her fertility, but also optimize the well-being of her future children.
Wow,
So
and what a way to think about it, that long-term perspective. A
mhm.
lot of times women are maybe not as willing to put their own health in a place of priority, but when it comes to their children, they are. And so that's a really helpful
Mhm.
perspective of
Mhm.
thinking about our future children. And so wanting to invest in our health now on behalf of those children before they're even born or conceived. So that's really beautiful.
Thank you. It's so critical because a lot of times when we work with women or who have challenges with fertility, they want to get pregnant today. And I get that, and my drive is to really like optimize their health. And because if
Yeah.
we have a challenge in our fertility, if we have an autoimmune condition, then there's something amiss, something wrong in the system that needs to be addressed.
Oh, maybe you could help our listeners understand a little bit specifically about what autoimmune disease
Mhm.
is. I think
Mhm.
we've heard that term, but not everyone feels really comfortable with it. So, how would you define it?
Well, autoimmunity is probably something that our ancestors didn't really have to handle 100, 200 years ago. It's really something that's increased over the past several decades. And what it is basically is when your body, your immune system, mounts an attack on its own healthy tissue.
Hmm.
So then, so it can manifest in a myriad of different ways, and pretty much every tissue in the body can be affected with an
Wow.
autoimmune type of condition.
Yeah. So, how could those autoimmune issues show up for us in our menstrual cycles or fertility or just women's health in general, however you'd like to think about it?
Wow. Well, I mean, it's just so many different ways. It's so interesting. I mean, when you're looking at, it could be, we do something in functional medicine. Maybe your listeners have seen a functional provider before, called a medical symptom questionnaire. And it scales from like 0 to 200 being the highest number of symptoms. And it can be anywhere from headaches, brain fog, fatigue, hair loss, weight gain, um, joint pain, muscle pain, gastrointestinal complaints, skin issues, mood, even. So you'll just see sort of the gamut of symptomatology. But what's also interesting is that I will have patients come to my practice who may have really high autoimmune markers, but don't have a lot of symptoms.
Mm.
So it's not always geared, but I pretty much feel today that almost everyone should be at least screened for autoimmunity. That they if they have antibodies to their self tissue. It may not be that that it's really serious and that it's, in other words, there's no evidence of end organ damage, even though we're finding those markers. But at least we're aware there's something amiss in the system and it needs to be addressed. And as
Yeah.
far as the menstrual cycle, I mean, you can see a lot of PMS, um, anovulation. It can affect definitely the ovulation, the luteal phase issues, luteal phase defect with the sacrifice of hormone progesterone because of all the inflammation. And then it can go on to impact fertilization and implantation and all of those things. So,
Of course. Yeah. I think that it's so interesting. We talk here a lot about how the body is interconnected. And so you really can't just take the reproductive system out and look at it on its own. You have to think about the whole person and the whole body and the whole system there. And so I love that the first symptoms you gave were symptoms that weren't specifically related to what we think of as, menstrual cycles and reproductive health. They were just overall health symptoms. But obviously, you're saying that those can have an impact on your reproductive health, whether you're trying to conceive or not. They can impact those hormones and the process of having regular healthy cycles. Is that right?
yeah, and there's a strong correlation with conditions. Say, maybe your listeners have heard of Hashimoto's, probably the most common autoimmune diagnosis I see in my practice, which is autoimmune thyroid disease, which can definitely impact someone's fertility and their menstrual cycle, right? But there's a high correlation between a condition like Hashimoto's or autoimmune thyroiditis and endometriosis and polycystic ovarian disease and premature ovarian failure, which can be autoimmune in nature. So
Mm,
those diseases like endometriosis and PCOS aren't considered autoimmune, but they're correlated with autoimmune disease. So by
yeah.
addressing by addressing root cause and by addressing autoimmune conditions, you're often also helping address the other conditions that impact fertility.
Okay, so if someone came to you and they were diagnosed with an autoimmune issue, whether it's Hashimoto's or something else, what
Mhm.
is going to be that functional approach to that diagnosis? Would it be pretty much standard what you would get in any sort of Western medicine approach, or is it going to be different because it's functional?
Definitely is going to be different from my perspective and from a functional root cause perspective. In medicine, we don't have autoimmunologists. So when a
Hmm.
patient comes, so patients will get, say they have Hashimoto's or type 1 diabetes, they'll see an endocrinologist. If they have MS, they'll see a neurologist. If they have, ulcerative colitis, they'll see a gastroenterologist. So, it's like there's nobody for these patients to go to say, okay, there's something awry in my system. I want to address like why this happened. The conventional treatments, they may just do a wait and see approach, or they
Hmm.
may, if it's serious enough, they may go on what we call biologics or disease modifying medications if they need to. But from a functional standpoint, I'm always like, well, what's driving this?
Yeah.
So I have a really nice mnemonic that I use, FIT, FITT. So, and we can go into that, but I look at foods, I look at chronic infections, burdens, I look at toxicants, which is a huge driver, and then trauma. So I look at
Hmm.
those like what's driving that underlying cause. And we need to sort of fish this out through history, through exam, through testing, and address those imbalances and those insults, if for lack of a better word, the drivers of chronic inflammation that are driving this autoimmune process.
Wow. Is it always or predominantly inflammation that creates the
Yeah.
autoimmune reaction?
Yeah, so people think autoimmunity causes inflammation. No, inflammation is unresolved inflammation is what's causing the autoimmunity. And then it's sort of like
Hmm.
and then the autoimmune condition itself creates more inflammation. It just becomes this like So we got to get under, like, we got to draw down inflammation in the patient. And there's many ways we address that, but we also need to kind of address the root causes, which are numerous.
Absolutely. And I really like the specific approach you take because even when you hear, oh, well, we have to take care of inflammation, that feels very broad,
Mhm.
very general. And so it's
Yeah.
like, ah, where do you even begin? But even having the FITT, there's a place to start. It can
Mhm.
be helpful. And now I'm not surprised for you to say food as the first one when we talk about what's causing inflammation, because that obviously can.
Yeah.
But do you find it's a combination of all four of those a lot of times, or is it usually like, oh, this one, is kind of specific for each client?
Yeah, that's why it's chronic complex illness. So it'd be great if it was just one instigant. And occasionally you'll see, oh, this patient has a high mercury burden from dental fillings and eating a high tuna fish diet or something. And like, we really got to draw that down. Or, they're really, really reactive to gluten, and getting gluten out of their system is having a profound impact. But for the most part, what we're seeing is it's multifactorial, many things driving that chronic inflammation.
Yeah, I would imagine, especially for couples who are trying to conceive, this could play a huge role in their ability to do that and what that looks like, how long it takes, how healthy and easy that process is. What does that look like when you have somebody come in who wants to have some preconception health consultations? What does that work look like with them?
So I always try to, oh wow, I guess we can go back to the fit mnemonic, because I'm always looking at what can we do to optimize their nutrition, right? We can take out the inflammatory foods, um, and we may have to test for that to see if there's specific foods that they're reactive to. Oftentimes we can get into the weeds on this one, but I'm very much about, and I don't know if your podcast has ever talked about the mitochondria and the importance of that in
A little
reproductive health.
bit, a little
Well,
bit, yeah.
well, baby gets all of its mitochondria from mom, all of it.
Mm,
So we got to, and all diseases, 95% of all diseases are mitochondrial, including fertility, infertility, and autoimmunity.
mm,
So without getting in the weeds on mitochondria, I'm doing whatever I can in my mind to optimize mitochondrial health in the mom, because I know baby's going to get all of its mitochondria from mom. So I do that by optimizing their nutrition. I want them eating like clean, non-GMO, organic, free of glyphosate, Roundup.
mhm,
This may sound kind of kooky, but I have them trying to eat seasonal and local and not eat like it's summer all year round. So
mm,
let's focus getting essential, making sure that huge, huge, huge part of it is making sure that they have the right nutrients, like essential fatty acids are key to immune health and reproductive health. So I do testing out of Johns Hopkins Kennedy Krieger Institute to determine if they specifically, do you really need fish oil? Like, I don't, we need to know specifically to optimize cellular health. So that's a big one, the food. And then we may assess for, you know, chronic infections. So are there dental infections going on from prior root canals or wisdom tooth extraction? Do they have dysbiosis in the gut that needs to be addressed? Do they have, I live in an area where there's a lot of Lyme disease.
mm,
You could argue that that's impacting fertility, definitely impacts the menstrual cycle. So we do testing for Lyme and some of the co-infections. They're very big drivers, Lyme and Bartonella and other co-infections, huge drivers for autoimmunity, chronic viral infections, assess for that. And there's treatments we can do to help mitigate that in people. Another one that's really big is toxicants. I don't know
mm,
if you've heard of the Million Marker. There's a millionmarker.com, which looks at endocrine disruptors in women.
mm.
Um, so doing kind of an assessment of their environment, their home environment. Like, there's so much that I do to try to
Sure.
optimize the health of the parents. Um, Toxic heavy metals, things like that, and then looking at a trauma history too. So to see
Mm,
if there's anything there from that standpoint that we need to assess and optimize. I hope that wasn't too much. I'm just trying to give an idea of what I look at.
absolutely. And you're painting really broad strokes because there is so much that you could investigate, but it's not like all of those things are going to come up for every single woman. That's why it's tailored to her and individualized. But I really appreciate, like you said, you work with chronic complex illness and you're trying to get to the root cause of that. So you probably dig a little bit deeper than the average physician does for that reason. And so I imagine there are going to be some listeners that are like, oh my gosh, that sounds like a lot. That's getting really nitpicky, really specific. Well, maybe, but also maybe because the women who are in this situation have already gone through the standard Western medicine and have not come back with necessarily what they want or what they need in order to be healthy and be successful with having a really strong menstrual cycle and the potential to conceive there. So this isn't maybe the average situation, but kind of that next level for someone who's struggling with autoimmunity or someone who doesn't just want to start taking medications, but wants to look at, is there a way that I can improve it before we have to get to the point of looking at medications? So is there any other advice or guidance that you would offer for women who are trying to figure out if maybe autoimmunity is playing a role in their women's health, or if they should address that in a certain way before they try to conceive?
I think checking in maybe with, a provider like myself, a functional who's going to take a little bit of a deeper look. You can go to your regular provider and have them say, hey, I just want to, if you're having issues with trying to conceive or having some physical concerns, and maybe check something like there's a nice marker called an ANA. It's not foolproof, but at least it's a nice screen to say, do they have a positive ANA that may indicate an autoimmune tendency? So
Yeah,
fortunately,
there's lots of reasons to do those initial screenings for
mm-hmm.
sure to see if that could be something affecting you. Well,
Yeah,
thank you so much for being on the show and sharing some of your expertise and experience, Dr.
I know
Davis.
it's a lot. I could talk forever about it. So yeah, you're quite welcome. It can be very complex, but yeah, but it's rewarding work.
Absolutely. Well, listeners, we are all about empowering you to understand your health and to get the best care possible. Why? Because you are made in the image of God, designed with dignity, and you deserve it. We hope that this episode has been helpful in the process. If you enjoyed it, take 5 seconds to leave us a review because every review has a direct impact on getting episodes like this one in front of others who are looking for trustworthy resources about their women's health. Thanks for being a part of that change. As always, thanks for listening as we continue to explore together what it means to be woven well.